got a question about, Dr. West, is there any alternative integrative functional medicine or alternative medicine treatments for pulmonary fibrosis? And so pulmonary fibrosis is when the lungs start to harden and fill full of basically it's not as pliable, it's not the lung tissue that it's supposed to be there. A lot of the medical treatments are, anti-inflammatory processes and observation, sometimes some immunomodulators or some other things. What the patient was asking me is, what can you do to help that? And is there anything that medicine doesn't know about? So I want to make sure that this isn't coming across as anti-medicine. It's something that actually can help to build on the traditional medical approaches for pulmonary fibrosis. So there's about 3 main things that you can do for pulmonary fibrosis from an integrative alternative medicine component. My favorite thing to do is to do IV DMSO therapy, so intravenous dimethyl sulfur oxide therapy. It's essentially, a refined tree sap with one minor side effect, that it really makes you smell because there's sulfur in it, and it smells like there's an outgassing for about 24 to 36 hours. But DMSO is a universal softener that I've seen amazing outcomes since 2006 for hardened conditions, any type of sclerosis, scar tissue, there's a component, but it works amazing for lungs. It helps to soften hardened tissue in the lungs, in my opinion. Now, obviously, this is not evaluated by the FDA. This is just what I've been seeing in practice I've been in practice 23 years. This is the last 17 years that I've seen favorable outcomes to DMSO therapy for COPD and pulmonary fibrosis. The other one that I really like is to do this German treatment here called the the Manual of Neural Therapy. This is a nerve reset therapy, and there's actually a specific protocol that for lungs. I apologize, this is going to see an anatomical female. There's a green screen, so it looks dark, but there's a specific way, it's hard to see because it's green, to literally go and help treat the lung fields by taking a glycolized ether of paraminobenzoic acid. So it's kind of a modified B vitamin. And what it does is it makes the nerve endings open and close and reset. It's really good for chronic nerve conditions. The technique is called neural therapy. It's been around since the 1920s, and there's a specific way that helps the lungs. There's also another treatment that I've seen for breathing and lung conditions called the infraspinatus respiratory reflex, or what's called the IRR. And the IRR treatment is really helpful for getting the nerves to reset that come basically out of the neck. So there was a doctor in New Orleans named Dr. Harold Philibert that noticed that his lung asthmatic patients had significant trigger points in a muscle in back underneath the scapula here called the infraspinatus muscle. And when he did some trigger point therapy, which is a needle therapy, getting the muscles to reset, what would happen is their lung fields would open up, they could breathe better. And he went and he published some literature on it. It's called the IRR technique, or the Philibert method. And so there's a really neat way to treat the muscle in the back. Part of the nerve goes up to the neck. The other part goes to basically the diaphragm. It has some intervention around the lungs and the lung field. And that nerve reset has helped people to breathe. So we have a softener. We have a nerve reset with neural therapy. We have a muscle reset with infraspinatus respiratory therapy. And then I really like to help the blood going to the lungs to be healthy by following this book by my friend Dr. Levy called Curing the Incurable. And it's basically an infusion of vitamin C with some sodium bicarbonate, with B5, with B6, with magnesium, potassium, zinc, and it helps the blood to be healthier. So as we get circulation through the lungs, not only is it we getting oxygen nutrients to the lungs, but we're also able to increase basically the health of that oxygen exchange. So there's my 4 treatments to help pulmonary fibrosis and congestive obstructive pulmonary disease. IV DMSO, neural therapy, infraspinatus respiratory reflex, and curing the incurable or advanced ascorbic acid therapy. So excited to be able to share this with people. I've seen really good outcomes. You can see the patient success stories on our YouTube channel, Healthy Healing TV, or on our Facebook. We have hundreds of patient success stories. We're in a little town in Idaho, a little railroad town called Pocatello, Idaho. I'm not the only doctor that does this, and I just want to make sure that people are aware that there's more things than just an anti-inflammatory, possible antibiotics, possibly an immunomodulator that's just suppressing things. Maybe there's a way to build things up. And by the way, I forgot one thing. The fifth way to help with pulmonary fibrosis is to help get building blocks for healthy lung function. There's a tissue extract of cow lungs called proteomorphogen therapy. It's specifically a very specific process way of getting lung tissue out of the animal source. And it's like a blueprint and helps the body to regenerate healthy lung tissue. It's never going to give you perfect lungs. I don't want to mislead you on that, but I've seen really good outcomes over 23 years using proteomorphogen therapy. That's a nutritional component for lung conditions. I'm Dr. Jason West and the West Clinic team, and that's what I would do for pulmonary fibrosis.